Welcome back to the Now Morning Show. So from the 24th to the 29th of May is Safe Cycle Week 2025. And this morning we have two representatives from Feminitt with us to explore this topic and also share what's going to be going on for that week. We have Elyse Cazabon, Research and Advocacy Officer from Feminate Caribbean, and Dr. Tehilla Paul, Safe Cycle Program Lead of Feminate Caribbean. Good morning, ladies, and welcome.
Good morning.
Natasha. Thank you for having us.
It's a pleasure to have you both on set with us this morning. Thank you for joining us. And looking forward to this conversation particularly because, at least from where I sit as we were talking off air, we don't necessarily see that much investment when it comes to period awareness, menstrual cycles, period poverty, and so much more. But before we get into that, let's first start with Feminitt. Doctor, let's start with you. Tell us a little bit about Feminate Caribbean, the background and the work that's done.
Sure. So Feminitt was launched in 2020, and we are a registered local NGO. Our focus is to co-create a world that is equitable for everyone, inclusive for everyone in Trinidad and Tobago. So our major work is within menstrual equity as well as education for health and well-being. But because these issues don't exist without overlaps, we also extend our work to climate justice, gender-based violence, as well as mental health advocacy. So we have two of our pioneering projects, the Safe Cycle program as well as the Right Way program.
Okay, so we're going to start breaking this down really this morning. Let's start with menstrual equity, because I know for many they'll hear that and go, what does that even mean? Can you share with us?
Absolutely. So menstruation is something experienced by women and girls and menstruating people all over the world. Menstrual equity simply means that everyone around the world that menstruates has the materials and the services that they need. It's a common misconception that period poverty is only about poor access to menstrual materials, but it also encompasses access to adequate menstrual education, menstruation education, as well as water and sanitation services. So that is why we would have launched a Safe Cycle program to address these issues, to reduce period poverty, as well as establishing mainstream menstruation education throughout Trinidad and Tobago. So we would have identified community leaders to establish hubs for education as well as service delivery. And using this approach, we would have launched 11 Safe Cycle care banks to date, 4 of which are in schools. So Safe Cycle Care Bank provides free menstrual materials for anyone in need within that area. So we also do that as well as reaching out for educational programs within and out of schools with children as well as parents.
Fascinating and very much needed as well. So Elyse, let's bring you back into the conversation. Good morning again and welcome. So as a research and advocacy officer, I would love to hear your take on what you've witnessed, particularly in Trinidad and Tobago so far when it comes to the status of period poverty.
Sure. So locally, like you said, it's something that sort of goes unnoticed or maybe unspoken about. A few years ago, so 2020, we did a Safe Cycle report. So us at Feminate Caribbean, we also partnered with Caribbean Feminist, and we did some research on, so at that point in time, we looked at like if people find that sanitary products are affordable, for example, and we had about 51% of people say that they did not find that sanitary products were affordable. Later, we saw the Joint Select Committee on Diversity within the Parliament. They did research following up on the same sort of question they asked people, and they had a sample size 3 times ours, and they found 93% of people saying that, you know, sanitary products are not affordable for them. And this is, like Tehilla said, this is something that everybody needs access to, you know, and if people can't afford, this leads to people being in uncomfortable situations. You get people having to, like girls having to skip school, these sort of things. And these are things that you maybe experienced but didn't really realize you were experiencing. Like maybe you knew someone who used to stay home a week every month in school and you didn't really understand why. You just thought, they're kind of slacking off. But it was something going on that they couldn't afford the materials to come to school and experience their menstrual cycle happily in school, sitting down where they can pay attention in class and, you know, not soil their clothes, these sort of things. So it's something that we find is a lot more prevalent than we realize. I don't know if Tehilla wants to add any more on our research findings so far.
So with regards to the work that we do, one of the main things that we want to communicate to people is that menstruation should never be a barrier to opportunities as well as education. And that's why the schools have been our main focus for our Safe Cycle care banks as well as for the benefit of our sessions. And we really look forward to this week, this upcoming week, where we will be in the schools again for our Pass the Pad tour sponsored by V-Mobile. We're really excited to really engage the students as well as the teachers once more.
This is wonderful. All right, so let's get into what's happening this week. We just got a taste from Dr. Paul. Elyse, expound for us.
So, like we said, it's not really a talked about topic. So that's why we've come up with the idea of Safe Cycle Week. So May 28th is Menstrual Hygiene Day. That's an international recognized day. And the whole point is to highlight menstrual hygiene, period poverty, and our work towards menstrual equity. So in recognition of that, we are hosting Safe Cycle Week, where we're having a couple events that just wants to reach out to the wider public, get onto people who've never heard about it before. So we're going to start off our week on May 24th, so that's Saturday coming. We're having a film screening followed by a panel discussion, and then afterwards an after party. So that's our main opening event. And so that's just to make it like an all-inclusive space for everybody. People can come and get a little bit of what they want, what they're interested in. So we have the screening, you get, thought-provoking questions, things to get people talking about this topic, because, we're not going to break down the stigma if we don't talk about it. So that's our Saturday. And then on Monday, we have our school tours, like Dr. Paul mentioned. So we're going to be in Tobago, talking with a group of students, primary school students on the Monday. Then that follows with, on Wednesday, we have our Interwoven, which is a cute little event that we're having, where it's a talk on climate justice and how that intersects with menstrual equity, period poverty, all these sort of things, because these things go hand in hand.
Yeah.
And so then that's going to be the climate talk, as well as we're having a reusable pad making workshop. So participants get to come and learn how to cut out their patterns, put things together to create reusable pads. So hence tying that back into the climate justice and the idea that we need to look for sustainable ways to experience our menstrual cycles. And then this is topped up, we have another school talk coming up, and then that is our Safe Cycle Week.
Wonderful. So let's go back to the panel discussion, because you would have mentioned there's going to be a screening. I don't know if we can know, but maybe you can tell us a little bit about who's going to be on your panel and what you expect to be discussed.
Sure. I'm going to hop over to Tehilla for this one.
Sure. So we have an exciting lineup of panelists for that day. So we have a representative from our Safe Cycle cohort. We're grateful, and we really depend on our community leaders that host our Safe Cycle care banks within the community. So we will have one representative, one care bank coordinator to speak about the experience over time and how it benefits the community, the underground work. We'll also have representatives from Carryman, from organizations like Kai. So we really do have an exciting lineup. I don't want to give away too much, of course, but we really hope that people can come out and hear about these experiences that these experts have. We will have a lot of insight on disabilities, menstruation and disabilities, involving boys and men in the discussions, as well as organizations like KAISO that really come in and give that special insight. So we're really excited.
So Dr. Paul, you answered one of my questions there, because I was about to ask, what about the men? Because the reality is, at the end of the day, they need to know what's going on. So for men who are watching, go out and make sure that you learn in the Safe Cycle Week for the film and panel discussion and the after party. Where is this taking place?
So this is taking place at Big Black Box on Murray Street in Port of Spain. It starts at about 6 p.m. on Saturday. We have a cocktail hour first, then we have our film screening and panel discussions that starts at 7, and then after party.
Wonderful. So is there a cost attached to attend?
Sure. So it's $50 at the moment for entry. We want to try and make it as accessible as possible, and also the proceeds from all of these ticket sales go towards funding our Safe Cycle Bank. So that's providing menstrual materials for people who need. The price will jump up to $75 and then $100 at the door, so you can show up and pay on the day itself. And it's a whole evening-long event, so you can show up whenever you can.
Yeah.
And then for the Interwoven event on Wednesday, that one is free. So registration is done via a link that you can find through our social media or through our website. So on Instagram, we are Feminitt, so FEMINITT. Or you can find us on our website, which is feminittecaribbean.org.
Okay, now if you can just walk us through what's going on in the schools, because that really is critical. And I know many will hear that and also will want to be involved. So maybe we can do this in 2 parts. Let's talk a little bit about what happens at the school and how we can be involved if we'd like to be involved.
Sure, absolutely. So education for health and well-being is a major focal point for the Safe Cycle program. So at the schools, we have lecture series as well as workshops, equipping students with information on menstruation and puberty, the tools that they require, because a lot of the times, most of us have been introduced to pads only, and we're not aware of the options that we have. We're not aware of how to name our anatomy, to name the parts, to really understand the process of what is menstruation, what's the difference between the menstrual cycle and actual menstruation? How do you prepare? How do you support your friends? And we are grateful for the partners that we have. This has been a collaborative work over time, and we're grateful for partners like B-Mobile specifically that's sponsoring this tour. Over the last 2 years, they have supported us in various manners. Last year, they would have conducted a menstrual pad collection drive among employees across Trinidad and Tobago, and that would have supported our Safe Cycle Care Banks, the stocking of the 11 across the country. However, this year, they've renewed their support in a new way. They've identified that education of the youth is important, so they have sponsored this tour, and I am really excited how we've transformed our curriculum and how this will be a workshop specifically to really have that hands-on involvement with the students. We're quite excited.
Yeah, definitely. It's something that I know many students, and it's also, admittedly, let's be frank about it, yes, we're very much in the digital age, but parents are going to be grateful for this as well, because
Absolutely.
they need to be able to have those conversations. Now, what about those who would perhaps like to donate, for example? Do you accept donations, and if so, how, when, and where?
Right, so we do accept donations. We will be accepting donations on the day at our event period. That's on May 24th at the Big Black Box. Also, you're free to reach out to us on Instagram. Our website also has options for donations. We accept physical donations of actual menstrual materials. If a monetary donation would like to be made for the purchasing of materials, we can accept that as well. Okay. So that information is all available.
Excellent. So you can see there on your screen, there's also the banking information for Feminitt. Make sure that you also go on social media and follow them. Something I'd love to learn a little bit now, though, Dr. Paul, we spoke earlier about the background of Feminitt. But let's speak about the growth, because when it started, would you say it's as large and the reach is as much as it is now?
So I am proud of the work that we've done over the years. We are a young NGO, we're youth-led. We have been operating specifically the Safe Cycle program for 5 years. We are happy to see that we are now approached by our community leaders. Instead of having to make that outreach, we are approached because people see the value of our work. They see the impact within the communities. We try our best to reach out to rural areas, to overlooked spaces, to offer this support. I think one of the main successes of this Safe Cycle project is not that we have only launched these banks, but they have been able to survive and to be some of them are self-sufficient, some of them are dependent on us for our restocks, but we have been able to retain these 11 banks that successfully serve the community. We have banks in schools, we have banks in Tobago as well as Trinidad and Tobago, and the work that we have done has progressed from occasional community-based sessions to a full and robust school program. So we're really excited about that and proud of the work that we're doing, and grateful for the partners that have supported us over the years, and also grateful for our community leaders, because without collaboration, we will not be here.
Definitely admirable. Well, ladies, thank you so much for joining us this morning. It's been an absolute pleasure. Wishing you all the best for the week to come, and hoping we can also have you back on again soon to see what's going on, initiatives and the success, because of course this will continue to be a success.
Thank you for having us.
Thanks so much for your time.
Of course. Feminitt CT here with us this morning, Elyse Cazabon, Research and Advocacy Officer, and Dr. Tehilla Paul, Safe Cycle Program Lead, sharing information about Safe Cycle Week 2025. Please go and check them out on social media, and make sure that you stay tuned, because there's more coming up after the break.
Pretty nails and shoes don't mean you have to trim man where you spend pan you. Woman, you confuse, real woman have them bang book. And we don't make